So just give you a framework of the legal provisions. The Social Health Insurance Act was passed last year in October and came into effect in November last year. So it's been in effect for close to 12 months. The Act creates a social health authority. That's the body that will be managing three funds: the Primary Healthcare Fund, the Social Health Insurance Fund, and the Emergency Chronic and Critical Illness Fund. So those are the key areas that have been created by the Act, and the regulations give more detail to these funds, as well as how people will be able to register to become members of the Social Health Insurance Fund, how they'll be able to make contributions, how healthcare providers will be able to join and do business with the Social Health Authority, and the benefits and tariffs that will be paid out to these healthcare providers. The Act and the regulations also deal with how claims will be made to the Social Health Authority, and they also create what is called a dispute resolution tribunal to deal with disputes between the Social Health Authority and any other third party, including, for example, the members or the healthcare providers. So this dispute resolution tribunal is something new that was not there before with the NHIF, and it will be able to, the idea is that it should be able to deal with these disputes much faster than before with how it was with the NHIF. So I'll start with the Primary Healthcare Fund. This fund has been created to receive payments, and the payment will be receiving funds, from the appropriation by the National Assembly. So the majority of the funds to this Primary Healthcare Fund will be through
Actually, we are losing you.
Appropriations from the sorry about that. Are you able to see my screen again?
Yes.
Okay. So as I was saying, the Primary Healthcare Fund is the first fund that has been created by the Act. This one will be used to purchase primary healthcare services, and these will be purchased from level 2 and level 3 facilities. That is mostly the health centers, medical centers, dispensaries, that level of facility. So the idea is that for the primary healthcare, a beneficiary will be going there for their outpatient needs, and for their initial, anytime they need healthcare, the first place they will go is the primary health facility. From there, they can be referred to the level 4, level 5, or level 6 facility, which will be paid for by the Social Health Insurance Fund. So primary healthcare is paid for through the exchequer, and it will be the National Assembly appropriating funds to pay for this. In order to access this primary healthcare fund, a beneficiary will have to be registered with the Social Health Insurance Fund. So the only requirement is that you must be registered with Social Health Insurance. This is not the contribution fund, so we'll talk about that one later. But for this primary healthcare, it's mostly that the person must be registered, and it will only be accessed in level 2 and level 3 facilities. The Social Health Authority also has the power under the regulations to approve a level 4 facility to offer primary healthcare. And this is for those areas where, for example, you may find the level 2 or level 3 facility is too far away. So in that situation, the Social Health Authority can allow a beneficiary to go to a level 4 facility to receive treatment. If someone needs additional treatment above level 2 or 3, they can be referred to a level 4 or 5 or 6 facility. And this is mostly the sub-county hospitals the county referral hospitals, or even the national hospitals like Kenyatta or Moi Teaching and Referral or KU Teaching and Referral. And it's both public, private, and mission facilities where you can access treatment. What type of services will be offered under primary healthcare? I think after this, there'll be a presentation on the benefits, but just in brief, the primary healthcare fund will be paying for promotive services, preventive services, curative services, rehabilitative services, palliative care services, and referral services. So I mentioned that after primary healthcare, if you need additional treatment, you are referred to the level 4, 5, or 6 facilities. These are paid for by the Social Health Insurance Fund. The Social Health Insurance Fund is now the contribution fund. So this is where the member makes contributions, or their contributions are made on their behalf by the national government or the county governments. So the requirement to access treatment under the Social Health Insurance Fund is that you must both be registered, and also you must have made your contributions. So how do we register? Registration is done by presenting your national identification document if you're a Kenyan citizen. If you're a resident alien, that is, you've been in Kenya for more than 12 months, you also have to make contributions under the Act. So you need to have your alien ID or work permit. Again, for refugees, they need to present their refugee identification. Once those copies of those documents are availed, then they can make the application either using *147#, that is the USSD, or going to the Social Health Authority website. After the person has registered, they will then be assigned a social health insurance number, and they can then have their biometrics taken at a designated service point. That can be either a Huduma Center or even a Social Health Authority office. For children, there are a few additional steps that have to be taken for registration. So the parent or guardian under the Social Health Insurance Act must register the child within 14 days of birth. So if they are registering that child within 14 days, they must bring the birth notification document. And if it's more than 6 months after birth, so for example, if they are registering them, let's say this month, but they had been born earlier this year, they will then need to bring the birth certificate of the child in order for registration to take place. And that will be, once that registration is done, the child will be issued with a minor social health insurance number. So the idea behind this number is just to distinguish between the beneficiary, who is a child who is under the cover of another contributor, and someone who is over the age of 18, who is contributing on their own behalf. So if you're still a child and you're under someone else's cover, you're given a minor social health insurance number. The biometrics for a child won't be taken until the child is over 7 years of age. And this is because the fingerprints especially are not fixed until usually until the child is over 7 years, so that once that happens, then the child's biometric can be taken. The Act also says that once a person reaches the age of 18, they're taken to be a contributor on their own behalf and a separate household. And here I should mention that one of the key differences between Social Health Authority insurance and NHIF is that social health insurance is based on the household. So even when you're contributing under social health insurance, the idea is that they will look at the entire income for the household and not just one person from that household. The same with if you are contributing as a person over the age of 18, you're deemed to be a separate household from your parents. However, just because you've reached the age of 18, you might still be living with your parents, or you might still be wholly dependent on them. So the Act allows that between the age of 18 and 21, the child can still benefit under the parent or guardian's cover. And if they're in full-time education, that is if they're in college or in secondary school, they can continue to benefit until the age of 25. Again, for registration of beneficiaries, if you're planning to register your wife or husband, then you'll need the ID of that wife or husband, as well as proof of marriage. So proof of marriage can be either a marriage certificate or even an affidavit of marriage. And this is because, again, the Act and the regulations recognize that a number of Kenyans have not yet registered their marriages, and therefore they will not have that marriage certificate. So it allows, in addition to the marriage certificate, other types of proof, including the affidavit. Where the contributor is registering an adopted child, they will need to bring the adoption order or a copy of it. If it's a child for whom the contributor is a guardian, they'll need to present the will, the deed, or the court order that has made them the guardian of that child. And in addition, the regulations allow for any other document recognized under the Children's Act. Again, this is just to ensure that no one is left out, because the Social Health Insurance Act requires every Kenyan to be registered. So in order to ensure that happens, it's not just the will, deed, or court order that will be taken to allow for guardians to register their children, but any other document that is registered is recognized under the Children's Act. For persons living with disabilities, under the Social Health Insurance Act, they are allowed to benefit under the guardian's cover and for the rest of their lives, as long as they are wholly dependent on that guardian. Kindly, if we could mute. Kindly, members, we'll mute our mics. Evans, kindly mute your mic. Thank you. So, for a person with disability who is registering with the social health insurance, they will need to present a copy of the ID, as well as the certificate of registration of the National Council of Persons Living with Disabilities. Again, the Act recognizes that there are those who are living in prison or who are in remand, as well as children who are in conflict with the law. That is, children who are in remand homes or who are in rehabilitation institutions. So for such persons, the government will actually be paying their contributions, but in order for them to register, they'll need the prison admission number or the remand identification number. If it's an adult, if it's a child who is in conflict with the law, they'll need the admission number of to the children's remand home, the rehabilitation institution, or the Boston institution. One of the key changes that happened last month in September is that previously the regulations were saying that everyone had to register afresh. So whether or not you were an NHIF member, you had to register afresh. But this was amended on 19th of September by legal notice, which now says that all members of NHIF will have their data transitioned to Social Health Authority upon verification with the government databases. So this has been undertaken. However, there are those persons whose data is either incomplete or has not been correctly transferred to Social Health Authority. So we are recommending for members to actually go back and still do the application form through *147# or through the website to make sure that they've updated all their details and that they've fully completed the form, so that once that happens, they're then issued the number. Just the transfer of data is not enough to complete the registration. The member might still have to follow the additional steps to make sure that they register with the Social Health Authority. So having talked about how people register their beneficiaries, there's also the issue of amendment. That is, how does someone who has registered their beneficiaries change those beneficiaries? So if you're adding a spouse, it's just the same as before. You get the spouse's ID and proof of marriage. If it's a child, again, just as before, it's an adoption order or a will, deed, or court order if it's you're a guardian to the child. If you're changing the spouse, for example, if there's a divorce, then you'll need to present a copy of the divorce decree. If your spouse has died, then you'll need to present the death certificate in order to amend your spouse's details. The registration of a beneficiary will only take place in one situation, that is where the beneficiary dies. And here the Social Health Authority will be notified by the Principal Registrar of Births and Deaths that the beneficiary has died. So the key thing here is that if someone has paid ahead of time, for example, someone who was self-employed and had paid for the whole year, and they pass away, then the family, that is the spouse and the children, will continue to access benefits until the end of that contribution period. So I've mentioned that the Social Health Insurance Fund is the contribution fund. Here, the contributions are the same for everyone in terms of the amount. Everyone will be paying 2.75% of their gross income. However, there are key differences. So where the contributor is in salaried employment, they'll be paying monthly. So it will be 2.75% of the gross income, paid monthly, and paid by the 9th of each month. For a household with income from non-salaried employment, that is those who are self-employed, for example, farmers and people who run their own businesses, they'll be paying the 2.75%, but they'll be paying it annually, and they'll have to pay within 14 days before the lapse of the annual period. So, for example, if I wanted to be covered in 2025, I would need to pay by middle of December this year to ensure that I'm fully covered for next year. For households that are in need of financial assistance, that requires that the national government and the county governments pay for them. And they will be assessed, first of all, through means testing. Once that is done, then it will be identified that this household needs financial assistance, and the payment will be done annually by the government within 9 days from the date of the annual contribution is due. The Social Health Insurance Act also creates a penalty for failure to make the contribution, and the penalty is 2% of the unremitted amount. I mentioned the means testing. This will be used for the households that are non-salaried, so that is those who are self-employed, as well as to find out those who need financial assistance. So means testing is done through a tool that is also part of the application form. It was developed by the Ministry of Health and the Ministry in charge of Social Protection, as well as the working hand in hand with the county governments. So once you fill in, if you are filling in the form as a self-employed or a person in need of assistance, the form will take you to that means testing tool, and it will then give you an amount that you're supposed to pay annually. And the amount is arrived at by collecting data from various socioeconomic aspects of your household. The key thing about means testing is that it will be done periodically. So it won't just be done once. If, for example, you lose your source of income, then through that periodic means testing, the Social Health Authority will be able to identify that you're someone who is now in need of assistance where previously you're contributing on your own behalf. And then you can now be assisted by the national government or the county government. So I've talked about the primary healthcare fund, social health insurance fund. The last fund is the emergency, chronic, and critical illness fund. So this one is accessed by two different sets of beneficiaries. The first group are those who have exhausted their benefits under social health insurance fund. So if you are a registered member who has paid your contributions, but after receiving treatment for your illness, for example, a chronic illness like cancer or diabetes, and you've exhausted your benefits, then you can still continue to access treatment under the emergency, chronic, and critical illness fund. The second group of people are those who need emergency treatment. So if for example, you have an accident or you fall ill suddenly and you need access to medical care, then again, this is the fund that will be able to pay for that treatment. And this second group of people, it's accessible to any person in Kenya because our constitution and our law require that everyone has a right to access to emergency treatment. So those two groups will be the ones who are able to access emergency, chronic, and critical illness fund. So I just discussed briefly the benefits. One other thing to mention is that the benefits are set by a benefits and tariffs advisory panel. This panel will be reviewing the benefits every 2 years. It can either add amounts that are paid under the benefits or even remove some benefits over time. So this is the panel that will actually be doing that work, and contributors and any other person can actually make applications to this tariffs advisory panel if they have suggestions on improvement of the benefits or changes to the benefits that they want to see made. So just briefly, the regulations have set out the benefits under the Social Health Authority. These are medical services that will be offered. There will be outpatient, inpatient healthcare services, maternal and newborn healthcare services, surgical healthcare services, dialysis, radiology, mental and behavioral healthcare services, palliative services, as well as oncology, that's cancer treatment, overseas healthcare services, dental and oral healthcare services, ophthalmic health services, that is eye care services, ear health services, screening services, rehabilitative services, assistive devices, as well as payment of mortuary fees. So that's just a summary of the benefits. The detail is actually scheduled to the regulations, sets out in much more detail the scope of the services, that is the type of treatment, the point of access, which facilities will be offering those services, how much will be paid to those facilities under Social Health Authority, as well as the access conditions. So, for example, for the primary healthcare, each beneficiary will be mapped to a primary healthcare network. After they've made the application, based on where they are geographically, they'll be mapped to this network, and they'll be able to access their outpatient services from level 2 and level 3 facilities within that primary healthcare network. The Act and the regulations also require that for services that require pre-authorization, that is those specialized healthcare services that need pre-authorization, the Claims Management Office must make a decision within 72 hours, and those decisions will be peer-reviewed when the pre-authorization is being made. So the maximum amount of time that Social Health Authority can take for pre-authorization is 72 hours. For those beneficiaries who need treatment outside of Kenya, you will remember I mentioned under the benefits that treatment outside of Kenya is one of those that is available. The requirements will be that contributions must be up to date. Secondly, that the treatment sought is not available in Kenya. That is, it's a type of specialized treatment that cannot be given in a Kenyan health facility. And that the treatment will have to be provided in a healthcare provider that is contracted by the authority. And finally, the beneficiary will have to make a request formally to the Social Health Authority for that treatment. With that, I've reached the end of the presentation. So it's just a summary of what is in the Act and regulations. But in case of any gaps or any clarifications, when we get to the plenary, I'll be happy to take questions. Thank you very much for listening. I now hand it back to Mr. Amoga for the next presenter.
Thank you, Archie, for that elaborate presentation. Members, I want to urge you to take note of the areas you want to ask questions. Then we will have a question and answer session after the 3 presentations. Please take note of the presentation, whether it will be the first, second, or third presentation. So at this point, allow me to invite Mr. Otieno to give us the second presentation. Otieno, please.
Oscar, are you able to see my screen?
I'm able to see. Can members confirm?
Yes, it's visible.
Can you proceed?
Yes.
The benefit package. And we just want to look at how we're going to reimburse various benefits. Some are staged to start immediately, some are starting on the second year. And then just see how the funds that Archie has mentioned are going to play through. So I will just start by mentioning that the understanding from NHIF perspective. So we used to have two kinds of contracts. That is, for hospitals, we had the comprehensive and uncomprehensive contracts. So what used to happen is, in case a hospital was a comprehensive facility, then they were able to get additional benefits that non-comprehensive facilities never used to get. So, for example, for surgical, if you went to an uncomprehensive facility like Aga Khan, Karen Hospital, and the like, we only used to cover for specialized surgeries. So the major surgeries, like people who require surgeries for fibroids and even for maternity cases, we always used to reimburse what the rebate, which some people used to call the bed rate. And then if you went to comprehensive, then most services were covered fully. Another thing to mention is NHIF used to have two types of schemes. So we had the UHC, which was called the super cover. And then at the same time, we also had managed schemes, that is the civil servants, police schemes, county government schemes, and the like. So that used to bring some confusion because some people realized some beneficiaries were able to get other benefits that others were not able to get. So what is now available in SHA, the tariff is one, either per household or per beneficiary. So if we are reimbursing whatever the amount we are reimbursing for maternity, for example, is what we'll reimburse at Aga Khan, it is the same we'll reimburse at KNH, and it's the same we'll reimburse at AIC Kijabe, for example. So that allows the member to choose where they want to go and access service. And it also helps understand the package better, achieving standardization. I've seen some questions about whether if you're working in a level 4, what happens? Do you need to go and seek services in a level 2? What this benefit package envisions is to ensure everyone is treated equally. So in terms of benefits, everyone is treated equally. You can all access the same benefits. The only difference comes in during contribution that Archie has explained. But even at the contribution side, we realize it is now a proportion, which is more also an equality feature, because you are having a proportion of your salary deducted. So everyone is 2.75. So I think at that point, I'll just start my presentation. I'll start with the journey. So how did you get here today? The law provides the CS should be gazetting a health benefits advisory panel that will be reviewing benefits from time to time and determining what benefits will be covered under SHA and which ones will be shelved for later. That advisory panel is not yet in place, but the CS did appoint a team that comprised of a team from Ministry of Health, a team from other stakeholders, and then a team from SHA that reviewed the benefit package and came up with these rates. So what was done was, first of all, there's an identification of potential benefits to be included in the benefit package. So at this stage, you just look at everything that is available within the country, all the health benefits. And I remember when this process started, the value we were talking about was around 700 billion. That is the total cost of health expenditure within the country for everyone. So at that point, then you cost the benefit package, and that's how we came up with the 700 billion. So then you look at the data in terms of population in need. So for every procedure, for every benefit, there's a population that requires that particular benefit. And a good example is delivery. We are currently working with around 1.2 million deliveries in the country. So as you prepare for the benefit package, you have to be cognizant that we have 1.2 million deliveries. And ask yourself, from the data provided, of that 1.2, which percentage is cesarean section deliveries and which percentage is normal delivery? And the same applies to the rest of the other benefits. And then now you compute the total cost of the intervention, and then you look at the budget impact. So of course, you have to come up with a sustainable package. So your budget will determine how much you can cover. And we all remember at some point, we had a benefit package that was more comprehensive. It was almost 350 billion. And that was going to cover emergency and chronic illness at around 107 billion, primary healthcare at around 61 billion, and then the shift at around 166 billion. But now after the finance bill issues that we had, primary healthcare was allocated 4.1 billion, and then ECCIF was allocated 2 billion. So we had to optimize that benefit package based on the yield that was available. And that is why some of the benefits were reviewed downwards and are expected now to be upgraded once funds are available. So after that, then there was a validation of the benefit package. And as I mentioned earlier, so all these processes required stakeholder involvement in each and every stage. So in terms of the fund, we have funds. So we have the primary healthcare fund, social health insurance fund, and then the emergency chronic and critical illness fund. So for primary healthcare and emergency chronic and critical healthcare, they're both government funded. For primary healthcare, you need to have been registered. You don't need to have been paid up for you to access the benefit package. For social health insurance fund, these are members clubs, so you have to be registered and paid up for you to access the benefits. For emergency and ambulance service, it will be available for all Kenyans, whether you are registered or not. And then for critical illness and chronic illness, it's a benefit that is envisioned to come in once you exhaust your shift benefits. So for that, you need to have been paid up and registered as a member. Primary healthcare, these are the benefits which are under it. We have the outpatient benefit package, inpatient screening and optical service. Outpatient, we're looking at management of acute and chronic conditions, consultation, lab investigations, prescription medication, vaccinations, outpatient procedures, management of mental health conditions, health wellness and counseling, and then antenatal care and postnatal care services. The tariff is a proposed capitation of 900 per person per annum. And in terms of access, it's proposed to be accessed in level 2, 3, and select level 4 facilities. So I mentioned earlier that the question about whether if you're working in a level 4, remember we are having a standardized benefit package. And we will sympathize with people who work in level 4s, and since you can access the services there, but only select level 4s, which means you are in an area within your PCN, the closest hospital to you is a level 4, and there's no level 2 or 3 around that area. For those ones, they'll be selected to offer outpatient service. But where there's a level 2 and 3 around that area, then the first choice will be for you to either access services in level 2 or 3 facility. And the reasoning for that is we are going back to ensuring organizational of healthcare is done in the right way. Because remember, for level 2s, their main concern is handling outpatient cases only. So they should be the first point of contact when someone has an outpatient condition. Level 3, they can do outpatient. At the same time, they perform maternity, and some of them also do surgeries. So level 4, 5, and 6 ideally are supposed to be referral centers for serious medical conditions. And that is where the government is envisioning these. And remember, the primary healthcare fund is fully government funded. So the government is looking into ensuring that these hospitals are well equipped. And that is why the FIF bill was put alongside these other bills to ensure facilities are able to use the amount of money that is being paid from SHA to develop themselves. So because facilities are unique and they know what they need in different areas. At the same time, this is how the outpatient is going to be reimbursed. The 900 not it when you go for service, because there's some assumption that the 900 is the cost that is accorded to you for the service per year. The 900 is an amount that has been provided for when you're going to access, whether you access service or not. So what the PCN network has done is it's ensuring it allocates your PCN. So during registration, based on where you stay, you'll be allocated a PCN. So once we know the number of people in that PCN, then we will allocate this 900 per year, which is 75 shillings a month per beneficiary, whether these people go for service or not. And then we have weighted diseases so that when you visit a facility, by the end of the month, we'd be able to know this facility has seen 20 people, 10 had pneumonia, 3 had malaria, and these diseases have different weights. So this money will be shared within the PCN, the number of facilities within the PCN, depending on the number of people they saw and the types of conditions that they saw. And then optical services, this is also under primary healthcare, and this will cover up to 1,000 shillings per household, beneficiaries below 18 years of age. And these are across level 2 to 4 facilities, and it will cover for eye health education, eye tests and treatment of refractive errors, plus provision of eyeglasses. Then we have inpatient under PHC. The scope of inpatient is more or less the same across level 3, 4, 5, 6 facilities. The only difference is the rebate, because we appreciate that as you go higher, more services are availed depending on the level of care. So for the scope, it will include management of disease while admitted, consultation, bed charges, nursing charges, radiology examination, drugs, and post-discharge medication, plus physiotherapy and administration of blood and blood products. So the limit for admission will be 180 days per household, that's half of the year. And then the rate for primary healthcare under level 3 will be 2,240 per night. As a summary, I'll move into screening. This is a benefit package that is proposed to start in the second year because of availability of funds. And then we'll be covering top 4 cancers in terms of incidence, the ones that have a higher incidence, and that is breast, prostate, colon, and cervical cancers. And I've mentioned it will be rolled out in the second year of the benefit package. We move into TIF. TIF has majority of the benefit. With outpatient under SHIF, we have inpatient care, we have maternity, neonatal, and child health services, renal care therapies, mental wellness, surgical services, oncology, and then medical imaging and other diagnostics, and then overseas treatment. Outpatient under SHIF is only going to cover lab tests for these 4 priority conditions, that is diabetes, hypertension, sickle cell, and then COPD asthma. Diabetes at 4,300, hypertension at 2,850, and then sickle cell at 6,800, and then asthma at 700 shillings. The limit is once per person per year. So it's different from the basic outpatient. And for this, it means the members will be expected to cater for consultation and drugs at this point. Inpatient, the scope is the same as the one for primary healthcare. The only difference is the per diem rates. For level 4 is 3,360. For level 5 it's 3,920. And then for level 6 it's 4,480. Limit is still 180 days per household per year. Maternity, ANC, that's antenatal care and postnatal care, they'll be expected to be offered in primary healthcare, that is level 2, 3, and then the select level 4s. And then for normal delivery, postnatal care, immunization for the newborn, postnatal family planning, management of postpartum infections, management of complications for the child, and then provision on anti-D serum for rhesus negative mothers. This will be handled in level, all the levels in terms of maternity care. And then the tariff for normal delivery will be 10,000, and then the tariff for CS will be 30,000. Access rules, I've mentioned it will be across level 2 to 6. So when it comes to delivery, the member or the spouse will choose where they're going to deliver. And then we have renal care services. These will be divided into dialysis and then the renal transplant package. So for dialysis, it will cover for consultation, cost of temporary catheter insertion and removal. We have lab investigations, nursing care, and then the medications that are required during dialysis, and then the dialysis services by itself. Then we have hemodialysis and hemodiafiltration. Both of them will be reimbursed at 10,650 up to a maximum of 2 sessions a week. Then peritoneal dialysis will be reimbursed at 85,200 per month. And in case a top-up is required, the member or the beneficiary will be expected to top up. For renal replacement, it will cover for pre-transplant evaluation, the kidney transplant itself. Then we have post-renal replacement therapy. So pre-transplant evaluation for the recipient, this will be covered up to a maximum of 150,000 per household per year. Recipient surgery will be 700,000. And then the donor nephrectomy, this is the process of removing the kidney that is supposed to be provided.
Sorry to cut you short. There are complaints on the chat that you're very fast. Could you kindly slow down a bit?
Okay.
Right. Okay.
So for donor nephrectomy, this will be covered at 168,000. And then post-renal replacement therapy will have a limit of 200,000 per household per year. Mental wellness, this will cover for mental health education, counseling and psychosocial support services, screening, behavioral disorders, neurodevelopmental disorders, neurodegenerative disorders, and then we also rehabilitation for substance-related addictive disorders. So for outpatient services for mental wellness, they'll be covered under the primary health care services. For inpatient, they'll be covered on a per diem. basis based on the rates that were provided. So depending on the level of hospital you attend to. For rehabilitation, it will be covered at 7,200 per episode of rehabilitation. And where there's a top-up required, then the member will top up. And the access will be across level 2 to 6 facilities. Nema Gambo, kindly mute.
40716952.
Nema Gambo, kindly mute. So I'll move into surgical services, and these will include a scope of admission, provision of minor, major, or specialized surgical procedures, management of complications arising from surgeries. We have post-procedure pain management, physiotherapy services, critical care services related to the surgical procedure, and immunotherapy therapy for organ transplant. So for the surgical, there's a listing provided. It's in the Gazette notice that will be shared. So that Gazette notice has costs for every surgery, and that's why we mention it will be on a fee for service based on that listing. There'll be limits for the surgeries that can be provided per household per year. So 3 minor procedures per household per year, 2 major procedures per household per year, and then 1 specialized procedure per household per year. We have hematology and oncology services. So these will cover for chemotherapy, radiation therapy, hormonal therapy, and immunotherapy. It will also include lab investigation, apheretic platelets, and red cell exchange for sickle cell patients. We have radiological services, surgical interventions, and management of precancerous lesions. In terms of coverage, there'll be a maximum of 400,000 as a global budget for diagnosis, staging, and treatment of cancer. This moves away from the sessions that NHIF used to cover, where you used to cover up to a maximum of 6 sessions, and that was kind of challenging. So for these, diagnosis will cover up to 100,000, and then treatment will cover up to 300,000. So, and then approvals for oncology service will be based on guidelines that are going to be provided by MOH that have already been provided, and this was done through the National Cancer Control Program and then the National Cancer Institute. We have medical imaging and other investigations. So MRI, CT scan, CT angio, mammography, fluoroscopy, echo, EEG, and specialized ultrasound will be covered at a maximum of 2 per household per year. MRI at 11,000, CT scans at 6,900, CT angio at 8,000, specialized ultrasound that has Dopplers at 5,000 shillings, EEGs at 8,000 for a child and 5,000 for an adult. The reason why the EEG for a child is covered at a higher rate is because most children require to be under anesthesia when that procedure is being done. Mammography will be reimbursed at 3,000, fluoroscopy at 4,000, and then echocardiograms at 3,500. Oral health. This is another package that is proposed to start in the 2nd year of the benefit package, or as soon as funds are available, with a limit of 2,000 per household per year. It will cover for oral health education and counseling, screening and consultation, tooth extractions, fillings, dry socket debridement. We have suturing under local anesthesia, scaling and polishing, and also hepatic wound cleaning, plus management of infections like dental caries and periodontal disease. And then we have overseas treatment. So the Act provides that SHA to reimburse any overseas facility, it needs to have been contracted and empaneled. So that process is ongoing, and that for this package, it is proposed to start between the 6 to 12 months after implementation. This is to allow for the contracting to take place. The limit will be 500,000 per person per year, and then it is going to cover for medical and surgical procedures that are not locally available within the country. Then for the emergency, chronic and critical illness fund, it will cover for ambulance evacuation services. We have accident and emergency, chronic illness, assistive devices, critical illness, and then palliative care. So I'd mentioned for ambulance and accident and emergency, every Kenyan will be able to access it, whether they're registered or not. And then for the scope, it will cover for evacuation from the point of incident, that's for the ambulance, to the nearest facility that has an accident and emergency center. And then it also covers for the transfer of the patients requiring emergency and further clinical care from the facility. This is going to be done through a call center. So there's a national call center that is being formed that is going to handle the evacuation of patients. And then in terms of access and the scope, there's a tender that was done. So it's going to be competitive to determine who is going to win the bid. And that's how the scope for service is going to be determined and the amounts that are going to be reimbursed. For accident and emergency, it's going to be offered across all levels, that is level 2 to 6, on a fee-for-service basis. And I've mentioned this is going to be accessible to be all Kenyans, irrespective of whether you're registered or not. The only difference is going to provide care for only 24 hours, after which we expect that shift benefits are supposed to kick in. That's why now it's good to encourage people to register in so that they can be able to access the entire scope of service. For accident and emergency, it's going to cover for cardiac and pulmonary arrest. We have major trauma, shock states, altered levels of consciousness. We have convulsions, and then we have chest pain or stroke, and then anti-snake venom and anti-rabies. So those are going to be under accident and emergency package on a fee-for-service basis. Critical illness, this includes ICU, HDU, and then the severe burns unit and the like. Initially, we had proposals for tariffs for these benefit packages, but because of the availability of funds, we have to settle for rebate for now. So the reimbursement is going to be on a rebate, as I'd mentioned earlier, for level 4, 5, 6. The limits are still going to be as per the inpatient package of a limit of 180 days per household per year, and access point is going to be level 4 to 6 facilities. Palliative care, this is now going to be accessed in level 3 to 6. On a per diem rate still, the same per diem rates for level 3, 4, 5, 6, with the same limits for the inpatient as the one for inpatient package, which is 180 days. And for this benefit, it aims to enhance the quality of life for patients with serious, chronic, and life-threatening illnesses, which include symptom management, psychosocial support, pain management, and then caregiver support and end-of-life care. For assistive devices, this is also proposed to start in the second year of the fund, based on maturity of the fund, and it will cover for hearing aids at 55,000, walking frames at 500 shillings, foot braces at 1,000 shillings, therapeutic footwear at 1,000, and then crutches at 900. And it will be accessed across level 4 to 6 facilities. So hearing aids will be provided to only those individuals below 18 years for once a lifetime, and the rest will be provided for the entire population. So that's the end of the benefit package. For every benefit package, there are always exclusions. So for this particular benefit, the SHA won't be able to reimburse for cosmetic procedures unless specified in the surgical listing. We have those surgical procedures, especially after an accident. So like, for example, the maxillofacial, where someone has had an accident and then they need reconstructive surgery. Some of them are within the surgical benefit package. Those ones will be covered. But for other cosmetic procedures that are not listed in the benefit package, those won't be reimbursed. At the same time, SHA won't reimburse for treatment by chiropractors or herbalists. IVF is also not going to be covered for now. We are not saying it is not necessary. We're just saying for now, we cannot be able to fund it. Once the funds are available, it will be considered. And then for immunization, the vaccines covered within the KP vaccine, which is the expanded program, are the only ones that are going to be reimbursed for now. So vaccines like the baby-friendly vaccines won't be able to be reimbursed. And then the Kenya Essentials Medicines lists and then the Kenya Essentials Diagnostic list have both been upgraded. We have the recent versions. So only products within those lists are going to be provided for and reimbursed. And then weight management drugs are not going to be covered for now. We have medical costs related to Orin Cardinal research environment on clinical trials. Mostly these subjects are normally insured. And then for epidemics and pandemics, these are not going to be covered under SHA because normally this is taken care of by the public health under the Ministry of Health, as we saw during the COVID pandemic. And then professional fees for medical personnel over and above the prescribed rates. And then expenses related to diagnostic equipment included but not limited to, such as glucometer or glucose machine, and then any other procedure or intervention not listed in the scope of the benefit package. Then I'll mention about the vertical programs, and these are normally programs that are donor funded. So ARVs, antimalarials, anti-TBs, and associated tests, family planning commodities, and KP vaccines will continue to be provided at public, faith-based, and private facilities that report to the health information system. That's the end of my presentation. Thank you.
Thank you, Bana Otieno, for that presentation. Members, I hope you also taken note of the areas where you want to ask questions. I can see the questions already coming in through the chat wall, and also watch out for the responses. So at this point, please allow me to ask Bwana Osoro to give us the last presentation. Bwana Osoro.
Good morning, Oscar. Can you get me loud and clear?
Yes, you are clear. Proceed.
Can you see my presentation?
We can see your presentation. Naisula, please mute. Naisula.
Yes.
Naisula, please mute.
Okay. Or atapewa your amount. It's not our
Allow me
business.
to proceed. All right, thank you, Chair. I'll be taking the team through a presentation on the employer portal, and I'll be sharing the user guides on how to navigate the employer portal. For purposes of this meeting, my good name is Gilbert Osoro from the Social Health Authority, and I serve at the Universal Health Coverage Division. Now, that is the landing page when you log in, and of course, the website is www.sha.go.ke. When you land at the landing page, which you are currently seeing, it will welcome you to the portal, and you can undertake two functionalities. The first one, either to register as a new employer, and the second part is to log in as an existing employer who's already registered in the database. I'll take you through the first step, which is registration. And of particular note is that all employers are required to register with the Social Health Authority. And the registration process has been made seamless for employers such as the former employers under NHIF. That is, employers previously registered under NHIF are automatically migrated to SHA, and what is required of them is to update the information on the SHA digital platform for the continuity of services. We used to have the National Social Security Fund, NSSF, but that was removed because of the confusion that it was creating. As such, it's no longer active. The third way is for domestic employers, and for domestic employers, SHA introduced a simplified registration process, allowing employers to register their domestic staff for health coverage. The process was designed to ensure that workers in the informal sector who may have been underserved by the previous NHF, which is defunct, now receive comprehensive health coverage. Finally, newly established businesses are required by law to register the employees with the SHA as part of their compliance with the national regulations. You can activate this by the three methods I've shared. Activate with the NHIF e-service, which I recommend. If you are a new employer, you can register as a new business. And for those of us who have domestic workers, you can use the domestic employer to cater for such people. Allow me to take you through Activate with NHIF e-services, which is also known as by most employers as the monthly payroll byproduct portal. Now, when you land into this particular page whereby you want to activate with NHIF e-services, there are those mandatory fields that you must fill. That is the organizational details. Number one is the employer code, or number. At NHIF, we have employer codes. Employer email, this is the email that you previously submitted to register the monthly payroll byproduct. And finally, the e-service password, which is the monthly payroll password. Once you've completed those 3 mandatory fields, you can proceed to submit by clicking the proceed button. Now, on successful verification, that is confirmation of the details, the employer will be redirected to this page below. And this particular page, the employer will be required to update their records with SHA by filling in the required fields and attaching required documents. Among the things you need to complete is the organization details. Because you are previously registered with SHA, the organization name will automatically populate. You need to enter the details of the contact person, that is the system administrator, the contact phone number, the physical address, the postal address, the KRA PIN number. Of particular note, you need to upload the single business permit number or the certificate of incorporation and the KRA PIN. And the format for uploading is using PDF or JPEG. And I want to issue a rider here whereby the document should not be more than 2 megapixels for ease of uploading. The other important thing you need to note, you need to populate the admin details, including his first name, last name, cell phone contact, his email address, and you need to confirm that particular email address before you resubmit and proceed. I'll jump the activate with NSSF, which was deactivated because it had issues. I'll go to type C, whereby a new employer is registering a new business name. And to register as a new business in the SHA portal, you must complete the below form, whereby you capture the organization details, including the organization name, the contact name for the person who can be reached for that particular organization, the contact phone number, the physical address or location, the postal address. You need to capture the KRA PIN number. You need to upload 2 documents that are mandatory: the business registration certificate or the certificate of registration, and the KRA PIN, which are mandatory. And I have issued the guidance that for the documents you upload, they must be in that particular format: JPEG. They must be either in a PDF document below 2 megapixels in size. It's also mandatory to upload the admin details, including the first name, last name, cell phone number, email address, and you need to confirm the email for purposes of verification. Thereafter, you proceed and upload. For the new domestic employer, which is a new introduction, to register on the SHA portal, you must fill the form below, which includes the employer details, of course, the first name, middle name, last name, the national ID number, the KRA PIN, the phone number, your email, and you must confirm that particular email before you proceed and submit. I want you to take note of a particular development, that is password setup. We normally experience challenges here whereby people set up the password and sometimes end forgetting the password. Now, for password setup, instructions are shared to the email that you provided in the previous pages, whereby you will receive a text message in your inbox requesting you to reset the password for the Social Health Authority. And this is what you'll get. I've shared a sample of what will be sent to your inbox. Welcome to the Social Health Authority. You can see there, hello Dylan, and thank you for creating an account with SHA. To complete your registration, please set up your password by clicking the button below, the blue button below, which is titled Set Your Password. Once you click that particular box, it will land you to this page that is specifically used for setting the password. And there are some mandatory credentials that you must use to log in. One, you must capture the email that you pre-filled earlier on. You must enter the password, and you must confirm the password for purposes of verification. Once you've completed those 3 mandatory fields, you proceed to set the password by pressing the blue text box. Now you've logged in successfully. After the successful password creation, the user will be required to use the credentials created to log in as shown below. You'll enter the email address and enter the new password and proceed to log in.
Osoro, some of us are not receiving this email for updating the password.
Noted. Can you allow me to complete? Then I'll respond to that through the chair.
Proceed,
Now,
Bwana Osoro.
Thank you, Chair. The user will be required to enter the credentials and a 5-digit one-time password for the 2-step verification of the user as shown below. And the code will be sent to the registered email address and in alternate, the phone number. The one-time password, which is a 5-digit verification, will be entered here on this particular page. Then you click the blue text box to allow you to proceed. And I've shared a sample of the SMS of the one-time password, which is a 5-digit figure that you'll enter for purposes of the 2-stage verification. This is what you receive in your inbox if you successfully are able to log in. You can see your one-time password, and for purposes of enhancing security, you get the one-time password. Of particular note, for your security, the link expires in 3 minutes. If you do not set up your OTP within this time frame, you will need to require a new code for purposes of reset. Now, once you have entered the one-time password and the 5-digit authentication, it will take you to the dashboard. This is the landing page for SHA. And in this landing page, you'll see quite a lot. We have the payroll data, and of particular importance, it allows you to download the payroll template, which you'll populate and upload for filing your returns. It also provides for the SHA ID, which is system generated. It also provides for my organization, and it provides you with an overview when it comes to uploading of the total number of employees that have been uploaded. It indicates the submissions that you've made, that is the previous history, the e-slips that you've generated in the past, and your transaction history. It's a self-analyzing tool that will empower you to confirm the details that you uploaded. Once you download the template, which I'll be able to share down there, shared on downloading the template, whereby you click the download payroll icon. But I want to take you to the template. This is the payroll template that you'll download. It has, amongst other things, the payroll number, the first name, the last name, your national ID number, KRA PIN. Of particular note, you see gross salary. We decided to get rid of that gross salary because there was confusion. We have the contribution amount. Allow me to emphasize something on the contribution amount. It is the amount that is equivalent to 2.75% of the gross salary. So members take note that the contribution amount is 2.75% of the gross salary. Finally, we have your cell phone number. You are required to populate all those details before you proceed and submit. The good thing with this particular portal, it provides for additional amendments. In the event you've submitted your main payroll, then you realize that you omitted 2 names erroneously. You can add the 2 employees by clicking the add button, which is provided there, to manually input their data. And you need to complete the following fields: the payroll number, the surname, other names. You need to enter their national ID number, KRA PIN, and save the details and proceed to upload. This is the particular add member field that we are talking of. And you can see once you save, it proceeds to upload those 2 members whom you erroneously omitted. Now, I want to mention something on creating submissions. You've done your data, you've already saved it at your desktop, and now you need to make submissions. The first thing, you need to select the month of submission. In this case, we are talking of the month of October 2024. You proceed and select October. That is the payroll period. And it will indicate the number of people that you have uploaded. In the case you are seeing, once you select the month, you upload. There's an icon there written upload that is covered right now. Once you upload, you will receive a summary report of what you've uploaded, including the payroll number, employee full name, and you can see green icons, green tick, that indicate that you have successfully uploaded. You can see the ID number, the phone number. There is a new entrant, which is called CR number. The CR number refers to the client registry number. This particular CR number is system generated automatically. So you have no role there. Same case to the SHA ID number, which is system generated. Then you have the contribution amount and status. It will tell you that the card is active, and it has a time login credential. It will indicate when you updated this data 2 hours ago. Now, you can also navigate the dashboard by clicking My Organization. Under My Organization, the viewer can view the organization details, or of particular note, add other users to the system. We have the main user, the admin, but we realize that payroll matters are handled by many people. In event you go on leave, you need to add other users who can also be able to make returns in your absence or if someone retires. Now, under My Organization, we have users. You can click the user's icon, add the username, his bona fide email address, his cell phone number, and we have login trails. It will indicate the last login that new. If the user is new, it will indicate never. It will also indicate the status and the date it was created and the action. So you can see there, edit My Organization. You can edit the PIN number, contact email address, contact phone number, physical location, and addresses, amongst others. Now, when you're adding users, you need to complete the following mandatory fields: the first name, the middle name, the email address, the phone number, and you need to classify the type of user, whether it's an admin, finance, or operations, for purposes of allowing access to some specific areas. In event you forget your password, you can click Reset Forgot Password and provide your email address to regain access to your account accurately. You can see there whereby you enter your email address, and the new password will be sent to your email address, which you can now be used to log in your credentials as indicated below. So for reset password, you'll receive the reset password in your inbox, and you'll proceed to log in once more. Those are the screens you'll get to your inbox when you want to reset your password. And it's imperative you click the green text box, which is written reset password. And of particular note, this password reset link expires within 60 minutes. So you need to expedite resetting that particular password. Now, when it comes to password reset and confirmation, you will indicate your correct email address, the password, and you need to confirm the new password afresh and proceed to confirm. You will get a one-time password again, a 5-digit figure, which will be sent either to your cell phone or email for the 2-step authentication, which will enter. And remember, this one expires in 3 minutes. You'll proceed to enter and log in. With those very remarks, it brings the end to my presentation. Through the chair, we are ready to take in questions. Thank you.
Thank you, Bwana Osoro, for that presentation. Members, we are now ready for the question and answer session. As you ask your questions, kindly direct to the correct presenter so that you are answered correctly. So can we start?
Osoro, please address the issue of not getting passwords to set up the employer platform. And if it's possible to maybe change or use another email address once you've already registered with one.
Thank you. Through the chair, we have this issue that has been recurring over a period of time, whereby at the point of registering your password, you either captured the wrong email address, and as such, when the system sends an email, it goes to the wrong address. As SHA, what we are currently doing, we are currently working with the system developer to be able to amend the password that was sent erroneously, either by one, providing an alternative email address, or getting a 5-figure digit, the one-time digit to your registered cell phone number. I want to tell our esteemed user that that process has not been completed. It's ongoing. And as such, at the moment, we are unable to reset your email credentials, but the developers assured us that they'll be able to conclude the process in the course of the day. Thank you.
The email is okay. It's just we are not getting the one for now updating your password so that we can actually log in.
Can you confirm, are you getting emails to tell you that, because it is through the email?
It's a work email, so I get emails. So there's emails.
Have you gotten any emails from SHA?
None.
Which tells me either your email, either it's not correctly captured if you had me earlier on, because the way the system is configured, is if the email is correct, it has a two-way method of notifying you. It will send you a message in the registered email, and in case of the 5-digit number, it will go to your phone. Now, kindly confirm, are you getting anything on the 5-digit password in your cell phone so that we know where the problem is?
I even checked on SMS, nothing from SHA.
Now, I think there's a problem there. Both the registered phone number and the email are not correct. What you do, because that is a unique case, and we know a number of people who are ailing from such challenges, kindly, I'll request you do an official email. You can write to myself at gsoro@nhif.or.ke to allow me pass you the same, even as we come up with a system that will be used to authenticate lost credentials. But because it's a matter of urgency, kindly write to me. Thank you.
I already wrote to you, Osoro, and called and texted.
Yeah, the developers not finalized the pathway for resetting both the email address and the 5-digit number. It's works in progress. Kindly bear with us.
May I
I
ask
have
my
a question,
questions?
Mr.
Good
Soro.
morning.
Yes.
May I ask my questions? I have a few, so I'm just going to list them out and I hope you'll be able to respond. On the implementation of SHA, currently, once we have our registrations done, clinics and hospitals are not allowing for biometrics to take place, and therefore the activation of access to treatment is still not happening. I would like guidance on this. My second question, in terms of contribution as an employer, we are supposed to undertake a 2.75% in regards to the gross income. Please, we have no clarity on what the definition of your gross income is. And on my request to obtain information on this, I have been guided to follow and adapt similar process as what we have for the affordable housing levy. And so we are to consider just your basic, regular, repetitive income. So other elements like quarterly bonuses, commissions, overtimes would not apply. I would like clarity on that. My third question on the remittance itself, we have a very large population of employees, close to 400 workers, some of which are still struggling to have their details uploaded or receive a registration number. But I also am conscious that I will be doing the returns on the 9th of November. What happens to these workers who do not have a SHA number, and what would happen to their contributions? Guidance will be required on that, and making sure that to identify and also guide on will penalties be applicable to that contributor at the point at which they are able to successfully have themselves registered. My next question, we have situations where employees are working under various different companies, and so they have a primary employer and a secondary employer. Please guide how we are supposed to treat the SHA contribution on a secondary employer. And lastly, I would also like to know whom to speak with in Mombasa in regards to our SHA matters. Thank you.
Thank you for those questions. Indeed, there are quite a lot. Allow me to start with the issue you raised first, which is biometric identification at the point of seeking healthcare services. Biometric identification is works in progress. We are trying to finalize the issue of integrating to the National Registration Bureau, whereby the system will be reading biometrics. Allow the team that is working on the same to finalize, and we will be able to communicate. So that is a matter that I've taken note of. Of particular note, I note the request that you put across on what constitutes a gross salary, and you wanted guidance from SHA whether you'll be able to subject some of these allowances to the 2.75%. Indeed, I want to confess that we've received a number of requests that want a clarification, and I'm acutely aware there's a legal opinion that has been drafted, and I believe this morning when I reached out, they told me it's awaiting to be signed off by our team. It shall be issued. So let us allow the team at Legal Services issue that public notice and guidance. Now, there's an issue that you raised where what happens to workers who do not have SHA numbers, and what happens to their contributions. Now, registration is a civic duty of the worker. In event the month has come to an end and the worker has not registered, I want to kindly implore that you proceed and deduct. The way the system is made, it's that the primary identification key is the national ID. So on the day the worker submits or himself to registration, the system will be able to get the details and update its contribution history accordingly. So there's nothing lost. Please proceed and deduct, and kindly employ your workers to proceed and also register through the various portals that we've provided, be it the short code *147#, be it the web portal. And when I'm talking of the web portal, I'm referring to sha.go.ke or afyayangu.go.ke. So let them register, but in event they are unable to proceed to deduct, the same will be updated in the fullness of time. Now, there's the unique case whereby we have an employer working for the primary and secondary employer. I want to believe under both employers, the said employer is earning an income. Now, if you look at section 27 of the Act, it states this, and I want to read that for those in salaried employment, they will contribute an equivalent of 2.75% of the gross salary or wage. If they are earning then a wage, then it will be subjected to the 2.75%. At the moment, the Act is silent on secondary and primary employer. The overriding things it talks about the 2.75% of people who earn from salaried employment. In event there is any change, we will be able to communicate. On the issue of our contact person in Mombasa, we have the branch manager by the name Intiswar. You can do an email with, and I've shared my email. I'll give you the cell phone number and their registered email addresses for ease of communication, so that in event you have a challenge, you can be able to reach out to them. Thank you.
Mr. Osoro, I have a few questions also. One, is the deduction pegged at 5,000 or it can go past 5,000? Second question, for the organization that we registered erroneously as a new organization, last time during the webinar, you advised that you are instructing developer to transfer the data instead of another registration. How far is that? The other question is there any relief? Then the final question, I do not see my SHA employer SHA ID number. Kindly advise on those. Thank you.
Thank you. You asked 3 questions. The first one, if I got you correctly, is whether there is a ceiling in terms of SHA contributions, and you stated a figure of 5,000. The law as established talks of 2.75% of gross salary. And for purposes of this meeting, I want to say that there is no ceiling. If you earn 1 million, 2.75% is 27,500. That is what you'll deduct and remit to SHA. Now, allow me to report back on the issue of erroneous registration, whereby some employers, instead of updating their details, proceeded to inadvertently register as a new employer. And as such, they are unable to proceed because the system indicates that they're already captured in the database. I did indicate in the last meeting that we reached out to the system developer, trying to explore an avenue whereby you are to update your details so that it creates a nexus between the former contributions that you did to NHIF and the new registration. To date, the process is still ongoing because I spoke to the developer this morning. They are unable to finalize, but he did promise that it is works in progress and will issue a statement once they are able to do so. Finally, you did ask a question, what is the SHA ID? During the presentation, I did indicate that this system generates some IDs and which are found in the dashboard. If you go to the landing page of the dashboard, you will see something written, SHA ID, which is something related to the employer ID. It is automatically generated by the system upon successful submission of your monthly payroll returns. The other thing that is automatically generated by the system is the e-slip. The other one being the CR number, which is the client registry number. So kindly be guided, these are system generated. Thank you.
What about the relief? Is there relief?
I did indicate last time that as per the law established, we had a relief that was provided for under Cap 470, which is the Income Tax Act, Section 31, which provided that an individual or a member of regular and good standing who has remitted insurance premium is entitled to tax relief. But the wording of that section talks of contributions made to the National Health Insurance Fund, not the Social Health Insurance Fund. Based on that, our legal team has written to KRA and to the Attorney General to align that, because the intention has always been there. But up until when the AG provides guidance and KRA, at the moment, we are waiting for the feedback. So let us wait patiently for the tax authorities. What I want to say here, tax relief is not provided by SHA. It is provided by Kenya Revenue Authority upon filing of your annual returns. So you'll attach a statement indicating that you're a member of regular and good standing and apply for tax relief. Thank you.
Thank you, Mr. Osoro. I would also want to ask a question about those who visit, the members who visit hospitals like Aga Khan and Nairobi Hospital, because during the presentation, you've only been talking about level 1s and level 2s. So what applies to this kind? Before, they would pay like 900 for admission per night. So what is there for us going forward?
I'll direct your question to Joseph Otieno. I know he made a presentation. Joseph, access to high-end premium facilities is what the team is requesting. If Joseph is on board, I humbly request you respond to that.
I have a question, Gilbert. I have some questions. Hello?
Bwana Osoro.
Yes.
Otieno has joined another meeting. Kindly respond to that question.
All right.
Okay, I have some questions.
Okay.
One, in my organization, sometimes we have casual workers who we pay weekly or sometimes daily. Their calculations are done daily, and we do the payment like weekly. And some of them have very low take home, like about 3,000, 4,000. Are we required to calculate this 2.75 of their of what they are supposed to earn? Number two, are you willing to come on site to an organization if we request you to come and do registration? Because some of our workers have challenges going to the site, others accessing the USSD. Are you willing to come on site and assist? Number three, there's one staff who has not been able to access the portal. She's been given the message that her ID and phone number have a problem. So whenever she tries to access, she gets a message that the ID and phone number have a problem, but that is what she was using in the NHIF. How can you help? How can you be of help? Thank you.
Thank you. allow me to respond to those 4 questions, starting with the access to high-end premium facilities. We are talking of Aga Khan, Nairobi Hospital, Karen, and others. Now, my brother Joseph Otieno made a presentation of the benefit package, and in his presentation, he talked of access to the primary healthcare outpatient services. And he did indicate...
Maria Wanduka, please mute. Maria Wanduka, please mute. Members, please mute.
And he did indicate we have a primary healthcare fund, which will basically allow access to facilities in level 2 and 3, and which is funded by the Exchequer. Now, for the outpatient benefit package, as he indicated, it is basically for low-level facilities in healthcare centers, dispensaries, and of course, for you to access the other levels, CAF level 4, 5, and 6, where shift kicks in, it is only on referral. So the high-end premium facilities, many of them do not have facilities in level 2, in health center or dispensary. So access may not be possible, but in some of them have what we call the hub and spoke. If they have a level 2 facility in future or level 3, they'll be considered. But at the moment, majority of them do not have. I hope I'm very clear. Now, on the issue of casual workers, I'll again fall back to the regulations and the act that confines contributions to what we call 2.75% of gross salary. But not to just close it off, allow me to do further investigation, because the act says anybody earning an income. And the question we should be alive to, are they earning an income? Yes. It may not be monthly income whereby they have to wait for the 30 days, but they may be earning weekly or something like that. But of particular note, the framers of the act envisage that all Kenyans must be members. So my thought would be then, proceed and deduct, because these people also need access to healthcare services, even as we seek direction for these casual workers. On the issue of invitation to do on-site registration, I want to confirm that our offices are readily available. What needs to be done? Write an official invitation to the branch manager, indicating the time, the location, and the number of employees you target for purposes of planning. They can be able to come and do what we call assisted enrollment. We also have community health promoters that have been issued with tablets, and one of their key roles is to enroll households to SHA. You can write to the CEC Health, and they can be able to deploy the community health promoters to assist you to registration. Finally, the issue that you've raised, that one of your employees, upon attempting to register, was informed by the system that the ID and cell phone numbers had an issue. So those are unique cases. For us to make headway, I'll humbly request you do an official email so that we reach out to the system developer. We also subject the national ID to the National Registration Bureau for purposes of confirmation before we can be able to help this member. Thank you.
Allow me to ask a question kindly. So my question is on dependents. You mentioned that the dependents, the system from NHIF would move into, all of the details are moved into SHA. Does that apply to the dependents as well, or do we have to register the dependents afresh?
Thank you. Very important question. Now, for the former members of the defunct NHIF, and when I say members, I'm referring to the principal members. Their data, pursuant to the Legal Gazette Notice number 147, was subjected to external validation by the National Registration Bureau. and they were migrated to SHA. And the migration was not complete because we did write and inform those members that they were to proceed to the SHA portal for purposes of verifying or updating their details. So to come back to the question that you've raised, what needs to be done for those members, for the principal member, you need to log in to either the SHA portal or Afya Yangu, proceed to declare your spouse, proceed to declare children arising out of your marriage or adopted children, and update their details to the system for them to access services. So please remember to update details so that we don't lock anyone from accessing services. Thank you.
Allow me with regards to individual or employee registration. So I have experienced an instance where a staff accidentally input inaccurate data while registering for SHA. So is there another way to edit or correct those specific details, or can you provide guidance on what should be done in such cases?
Thank you, Christine. We have cases of people erroneously capturing either their names, ID number, or cell phone numbers, or the date of birth wrongly. We wanted to provide a holistic solution. We will soon allow members and the branch offices to allow members to edit or update details that are erroneously captured. As I want to indicate that that is a matter that is still under consideration by the team. And once the system is working, we will revert back and tell you to proceed and update your details accordingly. Thank you.
Allow me to ask one. Affecting anyone's
May I ask a question?
Hi, can I ask one question?
Yes.
If we have some consultants, how do we go about it, deducting SHA? Consultants who are like maybe a sole proprietorship or maybe just a consultant who is doing an ad hoc basis work.
Thank you, Rajput. The Act says anyone earning an income. So I want to believe those consultants are earning an income. Unless guided otherwise, you will proceed and deduct. Unless we communicate, because the Act is very clear. Any person in salaried employment earning an income. I rest it there.
But you see, they are not on our employment. They are not on our employment or nor on our salary sheet. They are they just issue us an invoice and we pay them according to that. So how do we go about it? We cannot deduct because this may be a temporary work for maybe a month or two.
For purposes to be, because the law is very explicit, it says anyone earning an income. I stand to be guided because that is what the law states.
So does that mean that they are responsible for themselves? I mean, deducting themselves?
No, it is you who is engaging them. Who will
so we put them on our payroll? Does that mean that we put them on our payroll on a temporary basis?
Section 17 talks of a household whose income is derived from salaried employment.
Yeah, but they are not on salary. You see, they are basically consultants on an ad hoc basis. They will just come work for a temporary time and then they'll leave. So how do we incorporate them? I mean, how do we add them onto our payroll? Because if we add them onto our payroll, that means that we need to deduct EAY, NSSF, everything. And that doesn't work out because they're just temporary in nature.
We can, I want us to confine our submission to what the law states. Actually, I'll read for you. It's actually section 16, which is titled, and I'll paste it there.
Mr.
Household
Rajput,
with income from salaried employment. Actually.
Hello, sorry, my connection was cut. I was asking, is it a consultant in a medical field, or what type of consultant are we talking about? Just for me to understand. Because
for company, it's like we have companies, we have various companies who are running their businesses in different sectors and all that. Now they could be hiring some consultants on an ad hoc basis at a particular point in time just to come, give advice, do some work, and that's it.
Yes, in that case, my understanding is that they will be given a contract that actually is very explicit that they're not employees, but they're working as outside contractors. Is that not so?
Yes.
Then in that case, it will be their responsibility to make their contribution as self-employed persons.
So it will be not the company's responsibility, but it's their own responsibility.
Yes, yes.
Okay, so we are not liable as such to pay
Yes.
SHA. Okay.
Yes, if the contract is clear that they're not your employees and they're not on your payroll,
yes,
then it will not be your responsibility, because in that case they are just outside contractors who are self-employed, who are providing a service to your company or your group of companies.
Okay, that's clear now.
Archibald, may I ask what is the process in regards to reimbursement for any area? This is an item that hasn't been touched by any of the speakers. Please guide.
Thank you for that question. Actually, I may not even be able to guide myself, but if you give me a moment, I can consult on that just within this meeting. I'm not saying afterwards, but within this meeting, if you give me a moment, let me consult on that.
Okay.
I have a question on international staff.
Yes.
Mr. Osoro, I have a question.
Yes.
All right. I know this has been asked before, but I don't think it has been exhaustively answered by yourself. It is with regards to application or registration with a new business, and you have been remitting as an existing business. So it's an existing business being registered as a new business. I know you have answered it, but you see now once you enter into the dashboard, the SHA ID is not displayed. And this is I'm assuming it's because you registered as a new business. You mentioned that SHA ID is automatically auto-generated. So does that mean that once we remit next month by the 9th, is that number going to appear, the old number?
Let me repeat this and I'm to post it on the wall. On SHA company ID, which I did indicated, is system generated. Now, at the point of you remitting contributions for October 2024, if the process is successful, the SHA ID will be automatically generated and posted to the system. I hope I'm very clear. I've posted something on the wall, you can be able to see it. So my question would be, have you paid to the bank, generated an e-slip and successfully remitted returns?
Not yet, no.
So let us wait. We will cross the bridge once you've done so.
All right, that's clear now. That's clear.
Okay. Mr. Osoro, I have a question on international staff. We have been told that there is no system to register them because most of them are trying using their passports, which is what they had used to register themselves on NHIF. So how do we go about assisting them? That is number one. Number two, I have others who have joined in this, a month ago, and the act says about someone who has been within Kenya for the last 1 year. So do they also now become members of SHA, or what happens?
Allow me to respond to the issue of the expatriate registration who normally register using a copy of the passport or the work permits and many others. Indeed, as you've clearly indicated, currently, the architecture of the system only recognizes national IDs that are issued by the National Registration Bureau.
Okay.
Now, to address your issue, we have written that they provide or they activate another window to enable these expatriates, refugees, aliens who are resident in this country to be able to register. So at the moment, that is works in progress.
But Gilbert, on this particular matter, I've had an expatriate who has been able to register using their alien ID card.
Yes, even us.
Their alien ID card was able to get them registered.
Remember, the single source of truth for our data is the National Registration Bureau. If it is registered at the National Registration Bureau, it can pick, because what happens at the point of registration, our system reads into the National Registration Bureau database. If it is there, then it can pick. But for others, like now foreign passports, refugees who have a document called mandate, it is not registered in NRB. That's why we have the challenge. But it is being worked upon. Yesterday, and to confess, we wrote to the Registrar of Persons requesting to be given a list of all refugees in this country. We are going step by step. We're expecting that database today so that we share with the system developer to have a repository for refugees so that the system can read in and be able to pull the data. We have also requested data for expatriates so that we are able to get that data embedded within the database so that it can read in for ease of work. But it's a matter that is works in progress.
Okay, thank you.
Allow, actually, you can respond to the issue. The last question that was raised, there are these expatriates who came in a month ago, and the law indicates that for those expatriates who work for more than a year, they require mandatory insurance. Let me invite Archibald to respond to that as I take water. Archie.
Sorry, I didn't get the question. I was still consulting on that issue of the reimbursement. Please repeat the question.
Okay, the question is, we have expatriates who have joined us within the last 2 months, yet the Act talks of someone who has been in the country for more than 1 year. So what happens to them? Will they be contributors, or they will not contribute until they are near old?
Okay, so for now, it will really depend on what type of contract they're on. If, for example, someone is here for a 6-month contract, it would not make sense to make them a contributor. It wouldn't even be a requirement under the Act. But if they're going to be here for more than the 12 months, my advice would be that you get started on the process of making them, putting them as contributors.
Okay, thank you.
Mr. Osoro, I have a question. So like I have been trying to register members in my hospital, but the problem is that when I'm trying to search for my hospital in my location, I'm not getting my hospital. I've been trying to get it through the web, and I've also been trying to get it through the USSD, but still I cannot find my hospital in my location. So I don't know what is the problem. Maybe you can elaborate on that.
Now, at the point of, I want to believe, you see, all providers were mapped based on the scope of services they offer. Secondly, their geolocation. We did geomapping, which was done by the principal ministry. What I'll request, you go to the medical council, first of all, confirm where your facility was mapped to, because they just submitted a list with the geographical location through the Health Information Exchange. They will be able to address that. Thank you.
Mr. Osoro, further clarification on the casual workers. So for those that we do make their payments weekly, do we stick with the 2.75 of their weekly income, or do we stick with the minimum deduction of 300 shillings?
Now, two things. The minimum payment is, of course, 300.
Yes.
But if you compute what they'll earn at the end of the month, that is what will give you the proper computation of what you need to deduct.
But you see, sometimes we normally can't tell if we have them this week, if we'll still have them next week.
Then it's safe to stay with the 300, because the big concern is they don't lack access to healthcare services. That is the overriding objective of government, that people don't have access to coverage. So if I were you, if they're not coming the other week, you better stick with the 300, the minimum, which is the best premium.
Okay.
Questions from Mr. Osoro. I apologize if you have answered it. On the shift template, I believe there's the second last column, which talks about the contribution amount. So on that column, the data to be populated, is it the employee's gross pay or the actual contribution to the social health insurance fund? Again, apologies if you have already answered it.
Oh, it's all right. Thank you. Now, if you look at the template I shared, there is a column called contribution amount. And I did clarify that the contribution amount is equivalent to 2.75% of the gross pay. So if you are earning 1 million, you should enter 2.75% of 1 million, which is 27,500. I hope I'm very clear, Bruno.
Yes, you are. Thank you very much.
Thank you.
Mr. Osoro, I have a question.
Yes.
On the dependents, they're saying that if the child is 18 years, you're supposed to have registered them, have them register, and then so that you can put them under your under the principal. What if the child has not gotten an ID? The child is in the process of getting an ID, but the ID has not come out. How do you deal with that? And then secondly, the children that you have registered were over 18. Are you supposed to pay 2.75 for the principal and then I pay for them also?